All right. Hello, everyone. Thanks for joining us for today's 1 hour free webinar from Prevention Plus Wellness LLC, located here in beautiful St. Augustine, Florida. I'm Dr. Chudley Wirch, and I'm the CEO and founder at Prevention Plus Wellness. So we've got an hour we'll be spending together, probably a little bit less. I've got a ton of information here, but rather than me reading all of the research, I think I'm just going to allow you to peruse it at your own leisure, but I will go over all the material to give you certainly the key information, because there's a lot of very, very good and practical information here regarding lifestyle behaviors and youth mental health. Now, a couple weeks ago, we talked about lifestyle behaviors and substance use. Today is an adaptation of that, or related to that, obviously a little bit broader topic of mental health. So these two go hand in hand, these two webinars. I just want to make sure that everything's working well. Can you hear me all right? If you can, give me a thumbs up, a hand wave. I just want to make sure. Thank you, Ryan. I appreciate that. Okay. So let's go ahead and dive right into it, because again, lots of information here. And if you were with us a couple weeks ago when we discussed healthy lifestyles and substance use and other risk behaviors, this will make a lot of sense to you. If not, it'll still make a lot of sense. And there's certainly overlap, because we'll be talking about the same lifestyle behaviors, that is nutrition, and particularly breakfast, and followed by sleep and physical activity. Now, when we talk about breakfast for this first objective here, when we're looking at the youth risk survey data, youth risk behavior survey data for all high school adolescents in the United States, when we talk about breakfast, we're talking about that measure of eating a breakfast every day. So that's sort of the cutoff. That's the recommendation among health organizations like Centers for Disease Control. So eating a breakfast every day, okay? And by the way, that doesn't indicate the quality of that breakfast, but eating a breakfast every day is one marker of a healthy behavior. Another is sleep duration, and the measure here is 8 or more hours every day. And for physical activity, the recommendation is 1 hour every day. So that's what we'll be looking at. Breakfast every day, sleep 8 or more hours every day, physical activity 1 hour every day. In relation to those youth not getting each of those required healthy habits. Secondly, we're going to review research. So first of all, we'll look at actual data from the health risk youth risk behavior survey data of all high school adolescents in the United States. Most recent data is 2019. And then secondly, we'll look at research, published research and reviews of research, looking at a little bit more broadly, not just breakfast, but nutrition in general, sleep, not just quantity, but quality, and sleep factors, and physical activity and sports. We'll look at all of those things in relation to mental health indicators. And then number 3 will come up with lots and lots of implications for youth services providers. That's you as prevention specialists, health specialists, fitness specialists, youth sports, parents, coaches, teachers, and so on. Okay, so this is being recorded. You'll get a link to this recorded session. You'll get these slides, and you'll get 1 hour CEU certificate. I'll send this to all of you today after today's session. If you've registered, you'll get this. So don't need to email me. Just look in your email inbox. If it's not there, check your spam folder, because of the attachments may have been sent there. As we go along, if you have questions, if you have comments, of course, anytime, click on the chat option and or the Q&A option, and type in your information, and we'd love to hear from you today. Okay, so first of all, let's look at lifestyle behavior prevalence and their relationship. And here's the prevalence. We showed this the other day when we were looking at these lifestyle behaviors in relation to substance use and other risk habits among young people. And as you can see, that young people are desperately lacking. Average young people are not getting the required healthy habits that are associated with not just physical problems, chronic diseases like diabetes and obesity and heart disease and stroke and so forth, but also we're going to make the case today for mental health quality of life. So only a third of US high school students are eating a breakfast every day. That means 2/3 are not, 66% are not. And of those eating a breakfast every day, we don't even know what the quality is. The question is not just the frequency, but the quality. In terms of sleep, only 22%, about 1 in 5 adolescents are getting 8 hours of sleep. Many more need more than that. They need 8.5, 9, 9.5, 10 hours of sleep. So lacking in breakfast, lacking in sleep. 23% are getting the required 1 hour of physical activity. So not even 1 in 4 are getting the amount of physical movement that their body needs for both physical and mental health. 29% are eating 2 fruits a day, which is good, but only 29%. And only 14% are eating those 3 veggies a day that are recommended. So very, very few reaching the goal, the standard of vegetable consumption in America. So 5 fruits and vegetables together, that's how that usually breaks out: 2 fruits and 3 veggies a day. Very, very few adolescents are getting the required amount of vegetable consumption, so important to physical and mental brain development. The relationship among these wellness behaviors, these health behaviors, breakfast and nutrition, sleep, and physical activity, is that they're viewed oftentimes as the pillars of a healthy lifestyle, the foundation of a healthy lifestyle. They interact with each other, they influence each other, and they're the core, the basis for overall physical and mental health development and functioning, and I would say performance as well. So let's start by looking at lifestyle behaviors and mental health. Again, these are Youth Risk Behavior Survey data. 2019 is the most recent version that you can manipulate online on the CDC website. And so I ran these crosstabs looking at the first indicator of mental health is this measure of feeling sad or hopeless. And this is an important measure because this is not, a little bit of sadness. This is a measure of feeling so sad or hopeless that it interferes with your day-to-day activities. And we're going to look at this in relation to these 3 lifestyle behaviors: eating breakfast every day, 8 hours of sleep every day, 1 hour of physical activity every day. So if you look to the left, you can see, by the way, there's a significant association, a significant correlation between this indicator of mental health problems, feeling sad and hopeless, and each of the lifestyle behaviors, such that these lifestyle behaviors, breakfast, sleep, and nutrition, seem to have some potential protective effect against this feeling sad and hopeless. So take a look at breakfast, the far left, for example. Those youth, those adolescents that were eating breakfast every day, you got 25% of those having some hopelessness or sadness. That's still a large number. We're talking about 1 in 4 feeling that. I think the measure is within the last year, versus not quite doubling, but very much larger, almost 43% of those not eating breakfast recording feeling sad or hopeless in the last year. So you could see the difference there, quite a large difference. Same with sleep. Those youth getting 8 hours of sleep every day, less than a quarter felt sad or hopeless. About 41% of those not getting sleep felt sad or hopeless. And lastly, physical activity, same kind of relationship. 29% who weren't getting an hour of physical activity every day reported feeling sad or hopeless. Almost 40% of those who weren't getting physical activity reported that. So those not eating breakfast every day, not getting 8 hours of sleep every day, not getting an hour of sleep, physical activity every day, are at greater risk for feeling sad or hopeless, such that it interferes with their daily activity. And this number has been growing over the past several years, and has been exacerbated, I think, through COVID. And so we're seeing a large percentages of youth, 30%, 40%, experiencing this indicator of mental health problems. Now let's go to one of several measures related to suicide. This is seriously considering suicide. And as we see again, just like, if I could flip back for you, feeling sad or hopeless, same kind of relationships we're seeing with seriously considering suicide. And that is breakfast, sleep, and physical activity appear to have a potentially protective effect, such that those eating breakfast, those getting plenty of sleep, those getting regular physical activity were less likely than those not to report seriously considering suicide. Okay, and you can see the differences. There's particularly a large difference in breakfast. 11% of those eating breakfast reported considering suicide. Doubling of that, almost 23%, who didn't eat breakfast reported suicide. Same kind of relationship with sleep, and same kind of relationship with physical activity. Let's go to the next level of risk for considering suicide, and that is planning suicide. Again, same kind of relationship. Breakfast, sleep, and physical activity appear to have a protective effect. And then the next level of risk, attempting suicide. Again, same kind of protective effect by breakfast, sleep, and physical activity. And then when you get to actually being injured during an attempt at suicide, because these numbers are so small, we see only one outcome, and that's with breakfast. So breakfast still, even with the small numbers, showed that breakfast did have a role in reducing injury associated with suicide attempts. So what can we conclude from these actual data of all high school students in the United States? Breakfast, sleep, physical activity were associated with less risk for experiencing sadness and hopelessness, as well as considering and planning and attempting suicide among all US adolescents. So implications: promoting eating breakfast and lots of physical activity and sleep, all very important for enhancing mental health and perhaps even preventing youth suicide. So really, really important relationships there with those three lifestyle behaviors and actual data. Now we're going to look at research. The question is, does the existing research, published peer-reviewed research and reviews of research, support the data that we just looked at, the actual data from the Youth Behavior Survey? So let's start with breakfast and even broader other measures of nutrition in relation to mental health. So let's look at that. And again, we're talking about youth. It could be children, it could be adolescents, it could be young adults. So this is the first study looking at diet quality and mental health in adolescents. This was a prospective, that means across time study, published in 2011, 3,000 adolescents ages 11 to 18. And there are a number of results here. If you look at number 2, there was a dose response between both healthy, which is positive, and unhealthy, which is negative diets, and emotion, and this emotional subscale of the pediatric quality of life inventory, which they refer to in short PEDS-QL. So this pediatric quality of life inventory was associated, the emotional subscale was associated with diet, such that higher healthy diet scores at baseline predicted higher PED-QL scores at follow-up, and higher unhealthy diet scores at baseline produce lower PED-QL scores. So, and also number 4, improvements in diet quality were mirrored by improvements in mental health over the follow-up periods. So number 5, this study highlights the importance of diet in adolescence, potential role in modifying mental health over life course. So this is just one study that we're going to be looking at, but it's a good study. And it was one of the earlier ones, 2011. The study looked at children's nutrition choices and their mental well-being. This was a cross-sectional study of 7,500 secondary and 1,200 primary school kids. This was just published last year. The higher combined adolescent fruit and vegetable consumption was significantly associated with higher well-being. So fruit and vegetable consumption important. Number 3, type of breakfast and lunch consumed was also associated with well-being score. The youth not eating any lunch had lower well-being scores. The type of breakfast and lunch was also associated with well-being scores. The findings suggest on number 6 that public health strategies to optimize mental health of children should include promotion of good nutrition. And the measures here were fruit and vegetable consumption and the type of breakfast and lunch. So we're talking about not just a frequency or quantity, but we're talking about the quality of eating. Mental health and skipping breakfast among youth. This was a study in Korea, a large sample, 62,000 middle and high school students. And the study found that feelings of sadness and despair and suicidal thoughts, plans, and attempts in the last 12 months were significantly lower for the breakfast eating group. And as breakfast frequency increased, happiness increased and stress decreased. So these authors concluded the frequency of eating breakfast was associated with mental health, and the importance of regular eating habits was confirmed. So regularly eating a healthy breakfast, really important to mental health. And this was a large sample of Korean children and adolescents. Here is a study of skipping and eating breakfast and emotional and behavioral problems among adolescents. And this was a massively large sample, 115,000 Chinese grade school students that were followed all the way to 12th grade. So I think 6th grade and 12th grade. So this study compared eating breakfast at home, eating breakfast away. Both were significantly associated with emotional and behavioral problems. 7 syndromes, including withdrawal, somatic complaints, anxiety, depression. You can read them there in number 2. Skipping breakfast showed stronger associations with the above problems and social problems. So these authors concluded eating breakfast away from home, and especially skipping breakfast, were prospectively associated, means over time, with more adolescents' emotional and behavioral problems. So eating or not eating breakfast, but even the location, whether they eat it at home, was better than eating breakfast away from home. So location of food. Effects of eating breakfast on children and adolescents. This was a review of research published in 2019. And these authors concluded that the studies indicated a positive effect on eating breakfast, positive effect on cognitive performance, academic achievement, quality of life, well-being, and morbidity risk factors. So this was a review of previous studies. And so those are, I put more weight on those because it's not a single study, but it's actually a review of multiple studies. A good quality breakfast is associated with better mental health in adolescents. This is a study published with looking at over 800 youth ages 13 to 15. And they found high quality breakfast consisted of 3 food groups, but only 11% of the adolescents ate that in a 3-day period. So for example, take my breakfast, for example, today. I had a bowl of cereal with banana. So I got the cereal, 1 food group, milk, another food group, banana, a 3rd food group. So that would be considered a high quality breakfast. And so only 11% of these youth studied ate a healthy breakfast in a 3-day period. The most common food groups were for breakfast that they did eat were dairy products, followed by breads and cereals. For every additional food group eaten at breakfast, the association of total mental health score decreased. So we're talking about we're talking about here quality of breakfast, and that's defined as 3 or more food groups. And so the more food groups at breakfast, like in most meals, like I would say in all meals, major meals, the healthier the diet. So these authors conclude, number 5, that breakfast quality is important component in the complex interactions between lifestyle factors and mental health in early adolescence. So quality of breakfast. Skipping breakfast and mental health among university students. Now we're looking at young adults, a huge sample of almost 22,000 across 28 countries. So it's an international study. And they found that infrequent as well as frequent skipping of breakfast, and even infrequent, I want to highlight that, skipping of breakfast was associated with all kinds of problems: depression, lower happiness, PTSD, sorry, loneliness, other health behaviors, sleep, etc. And so these authors, number 3, concluded that skipping breakfast is associated with all 9 poor mental health indicators, along with 10 of 15 other health risk behaviors, plus poor academic performance. So really highlighting the critical role of breakfast and mental health among university students. Children who eat fruits and vegetables have better health. This is a study of 9,000 children from 50 schools, and showed that eating more fruits and veggies linked to better well-being among secondary school pupils. Youth who consumed 5 or more portions of fruit and veggies a day had the highest scores of mental well-being. So the authors concluded that public health strategies and school policy should really be developed to ensure that good quality nutrition is available for children during the school to optimize mental health. So what can we conclude from all of these studies and reviews of research? The quality, the degree, the frequency, and even the location of healthy eating, including fruits and vegetables and breakfast and lunch, are associated with a range of improved or worsened mental health and well-being indicators among children, adolescents, and young adults across multiple countries. So very consistent, strong associations between nutrition and mental health in both directions. Better nutrition, better mental health, and vice versa. Now let's take a look at sleep. I don't have as much research in sleep to show you, but this very important review of research in social media and sleep quality and mental health in youth, published just last year, showed that there was a significant association between excessive social media use and poor mental health outcomes. There were 33 studies. Social media and poor sleep quality, 24 studies, and a significant association between poor sleep and negative mental health outcomes, 16 studies. In the longitudinal studies, under number 3, frequent social media was a risk factor for both poor mental health, 6 studies, and poor sleep, 5 studies. Some studies showed sleep quality mediating relationships between media and negative outcomes. In other words, media reduced quality of sleep reduced mental health outcomes. So the authors concluded under number 5, evidence links excess of social media use to poor sleep quality and negative mental health in youth. So social media is a risk factor, a component of this equation with sleep and mental health among young people. And then there is this study here, childhood sleep problems and mental health in adolescents. Almost 200 youth studied, revealing that children with higher levels of sleep-wake problems, which means difficulty getting to sleep or waking up too early in the morning. Kids with that at age 9, sleep-wake problems at age 9, had consistently higher levels of mental health problems between age 9 and 11. Initial level of sleep-wake problems at age 9 predicted mental health problems later, depression symptoms, anxiety at age 18. So the findings illustrated that childhood sleep problems may persist and may predict adolescent mental health issues. So sleep problems among young kids, children, may influence and predict mental health problems among adolescents. Sleep and mental health in youth. This was a chapter written in Sleep and Health 2019. And they found insufficient and poor quality sleep associated with worse mood and emotional regulation problems, increased likelihood of developing a mood and anxiety disorder, heightened risk of suicidal ideation. And so these authors recommended that really important public health issue for all of us, families, schools, clinicians, public policymakers, to improve sleep, to impact and improve the mental health of young people. Sleep patterns of mental health in US adolescents. This is a large national study of over 10,000 adolescents ages 13 to 18. And it showed the average bedtime for these youth was, I think that's a 24-hour clock, I think it's 10:37. The duration of sleep was 7.72 hours. What is that? I don't know. That can't be 7.72. I'm not sure how that's recorded, but average weekend bedtime delay was 1.8 hours, average weekend oversleep 1.1 hours. So the point they're making here is that, again, the average adolescent is not getting, going to bed rather late, not getting 8 hours of sleep. And then on the weekend, they're trying to make up for it a little bit by sleeping a little extra. And so these authors concluded abnormal sleep patterns may serve as markers of untreated mental health for adolescents. So looking at these unusual sleep patterns that youth might have, because these things can predict later on mental health disorders. So sleep patterns in high school or adolescents or US adolescents, sleep behavior and adolescent stress during COVID. This was published last year. Shorter sleep duration and higher level of arousal at bedtime before COVID-19 were significantly predictors of adolescent stress during COVID-19. Higher levels of arousal at bedtime and lower reported sleep quality during COVID were concurrently associated with higher levels of stress among adolescents, and even when controlled for pre-pandemic emotional behavioral issues. So the authors concluded, number 4, sleep duration and cognitive emotional arousal were both associated with adolescent perceived stress during COVID and useful targets for prevention intervention. So not just sleep duration, but at sleep arousal. In other words, if the kids are all wired, all jacked up, and that could be because of social media or some other factors, then that's going to influence sleep, and that could influence issues like stress and other indicators of mental health. So what can we conclude from all of these studies and reviews that we looked at? Number one, insufficient and poor quality sleep as well as cognitive emotional arousal that from that last study are linked to negative mental health among youth, with excess of social media also being associated with poor mental health and sleep quality. Number two, childhood sleep-wake problems predict the mental health of adolescents. And three, poor sleep patterns may serve as a marker for untreated mental health disorders. So sleep and mental health very, very tightly associated. Let's now look at the third healthy behavior. We looked at nutrition, including breakfast. We looked at sleep, and now let's look at physical activity in relation to mental health. This is a review of physical activity and mental health in children and adolescents, published 2019. Studies showed physical activity intervention effects for depression and are moderate in strength, while observational data were only small or null. Variable effect sizes were evident from interventions for reducing anxiety and improving self-esteem. Higher or improved fitness and physical activity are associated with better cognitive health and performance. Number five, the strongest evidence for a causal relationship is that for physical activity to improve cognitive functioning. And there is some partial evidence for improving depression. So physical activity interventions can improve cognitive functioning and may help reduce depression effects. So here's another review of school-related physical activity and mental health. Published in 2020, there was a significant beneficial effect of school-related physical activity interventions on resilience, positive mental health, and well-being and anxiety among adolescents. So school-related physical activity interventions may reduce anxiety, increase resilience, improve well-being, increase positive mental health in children and adolescents. So these authors concluded positive effects of physical activity on health in general, and these findings may reinforce school-based initiatives to increase physical activity. So physical activity, not just generally, but within school, really has great potential for enhancing mental health of children and adolescents. Children's physical activity, screen time, and mental health. Here's where we're adding in for the first time a little look at screen time. This was published, a national representative sample, 1,000 school-aged children in the US, published last year, and showed that that these school-age youth engaging in 7 days a week versus 0 days of physical activity was associated with fewer externalizing mental health symptoms in younger children. For older children, engaging in 1 to 6 and 7 days a week versus 0 physical activity was associated with lower difficulties, fewer externalizing symptoms, fewer internalizing symptoms, indicators of mental health. These are more screen time was correlated with higher total mental health difficulties among younger and older children. So these authors concluded more physical activity and less screen time were associated with better mental health among youth, making them potential targets for intervention. In other words, intervention strategies, campaigns that are designed to increase physical activity and reduce screen time among children and adolescents could have a significant impact on improving mental health. Exercise and mental health and mental well-being in young adults. Here's young adults again, looking at a sample of young adults 18 years and older, published last year, and the results confirmed that a healthy dietary pattern or dietary practice is more likely to promote exercise and improve mental well-being. So here we're seeing a relationship where a diet can improve physical activity and improve mental health. Number three, exercise improved the effects of food group eating and in a few cases minimized negative nutritional food group eating on mental health. So these authors concluded under number four, exercise may boost the enhancing effects of food groups on mental well-being and may lessen the negative impact of dietary impediments on mental well-being. So physical activity could really boost the benefits of healthy eating and to a certain extent, adjust for and assist mental health, even in the absence of poor nutrition. Very good evidence supporting exercise. This is for young adults. Youth physical activity and exercise and mental health promotions, a review of studies in 2019, 30 publications. Evidence suggested that interventions of varying intensity may lead to reductions in depression, and moderate to vigorous intensity and light intensity interventions may reduce anxiety. So physical activity and exercise is promising mental health promotion and early intervention strategy. So for those of us in mental health, substance use, physical activity important. Here the conclusion is: number one, physical activity interventions may improve depression in adolescents, while school-related physical activity are associated with a range of improvements in mental health and well-being outcomes among children and adolescents. Two, physical activity and less screen time associated with better mental health among children and adolescents. Number three, exercise may boost the enhancing effect of food group consumption on mental well-being and lessen the negative impact of dietary impediments on mental health among young adults. Okay, so we've looked at research that looked primarily at, a specific area, breakfast and nutrition or sleep or physical activity and mental health. Now let's look at studies that really looked at two or more lifestyle factors. That's why we're looking at lifestyle behaviors and mental health research. So there's quite a few of these studies. So lifestyle and poor mental health in early adolescence. This was the RAIN study, 14-year follow-up involving primary caregivers and their children. 1,800 is the sample size. Adolescents with higher intakes of meat alternatives, extra foods had poor mental health status. So here we're actually seeing what kind of nutrition and those products, those kinds of foods associated with less mental health status. Adverse socioeconomic conditions, higher hours of screen time. There was the screen time again. Smoking, early sexual activity were associated with increased mental health scores indicative of poor functioning. So these results suggest that consideration of lifestyle and demographic markers that are linked to mental health scores in adolescents is a good starting point for developing a multi-focus intervention aimed at improving mental health. So here we're going to see, I think, a number of calls in this research, these broader lifestyle studies calling for interventions and strategies that address multiple health behaviors to improve mental health of young people. Here's another study, Youth Physical Activity, Dietary Behaviors and Mental Health, published 2020. And there's three areas: feeling sad and hopeless, suicidal thoughts, attempted suicide. If you look at each of those blocks of content, you'll see how each of those indicators of mental health were associated with a number of lifestyle behaviors, nutritional factors like breakfast or drinking soda, physical activity, sports participation, computer time, et cetera, et cetera. Again, indicating the linkages between lifestyle behaviors and mental health among young people. Lifestyle behaviors and mental health in early adolescence. This was a prospective study, 3,400 10 to 11-year-olds, examined diet, physical activity, sleep, sedentary behavior, and mental health, and compared to meeting 1 to 3 health recommendations, meeting 7 to 9 recommendations was associated with 56% fewer physician visits for mental illness during follow-up. So I think this is a very important study because we're not just measuring indicators are actually measuring physician visits for mental health. Number 3, every additional health recommendation met by youth was associated with 15% fewer physician visits for mental health. So these authors concluded, emphasizing the lifestyle recommendations may reduce the future burden of mental illness. So a very fascinating and a very important study here published in Pediatrics, in the journal Pediatrics. Healthy lifestyle behaviors and mental health in early adolescence, published 2020, over 1,000 12 to 18-year-old adolescents. Results showed that all healthy lifestyle behaviors were associated with at least one mental health outcome, except for alcohol. Lower sleep and daily breakfast was significantly associated with lower mental health on all studied indicators. So again, highlighting those two particular wellness behaviors, breakfast and sleep. Findings support the value of integrating healthy lifestyle behaviors in interventions for mental health promotion. I'll say it again, so important. Integrating healthy behaviors in interventions for mental health promotion. And we saw the same kind of thing a couple of weeks ago when we looked at the relationship between these healthy behaviors related to nutrition, sleep, physical activity, and substance use and other risk behaviors. The big three health behaviors and mental health among young, adults. This looked at over 1,100 young adults, age 18 to 25. And results showed that sleep quality was the strongest predictor of depression and well-being, followed by sleep quantity and physical activity. Only one dietary factor, raw vegetable or fruit consumption, was predicted well-being. The authors concluded that sleep quality is an important predictor of mental health and well-being in young adults, whereas physical activity and diet are secondary but still significant factors. These are among young adults, again, looking at these relationship with these lifestyle behaviors. Here's Lifestyle Factors and Mental Disorders, a review published in 2020. There was evidence of the use of physical activity and primary prevention and clinical treatment across a spectrum of mental disorders. There is evidence implicating tobacco smoking as a causal factor in both common and severe mental illness. There's a need to clearly establish causal relationships. Poor sleep is a risk factor for mental health. So the authors concluded, number 6, and this is a review of multiple studies, effectively addressing multiple lifestyle factors in young people presents a promising approach towards tackling the rates of mental illness across population. I think this is a good review because you're seeing not just, the fact that healthy behaviors like physical activity or sleep promotes mental health, but that, substance use like tobacco is associated with reduced or mental health problems. I should say, not substance use, mental health problems. I misspoke there. So, in other words, restate it: physical activity, sleep, other health behaviors associated with better mental health, less mental health disorders, and substance use like tobacco use associated with greater mental disorders. Association of lifestyle and mental health in adolescence, over 75,000. This is another large Korean study that showed smoking, drinking alcohol, sexual activity, skipping breakfast, sleep problems, all associated with mental health problems like depression, suicide ideation, stress. The mental health problems of adolescents may be associated with negative health behaviors, such as smoking, drinking, and alcohol and sleep. So lots of relationships there. Adolescent health behaviors and mental health, published last year, looking at a whole range of health behaviors: physical activity, diet, smoking, alcohol use, sleep, and self-reported mental health. And they found that meeting physical activity guidelines, consuming breakfast every day, not smoking, not consuming alcohol in the last 30 days, and sleeping at least 8 hours were independently, each individually, associated with lower odds of mental health problems. And for every one additional positive health behavior met, there was significantly lower odds of reporting mental health problems. So this study supports the need for programs that integrate the targeting of multiple health risks among adolescents to improve their mental and physical well-being. So what can we conclude from all of those lifestyle studies? Number one, health risk behaviors and the amount and frequency of healthy behaviors associated with negative and positive mental health outcomes respectively. In other words, mental health risk behaviors were associated with less mental health or greater mental health problems, healthy behaviors associated with greater mental health or less mental health problems among adolescents, among young adults, highlighting the benefit of integrating multiple health behaviors within single prevention interventions for reducing mental health. Number two, substance use and behavioral health professionals, teachers, coaches, parents, all of us should really be, who work with youth, should really be providing youth with motivational strategies to initiate and to maintain recommended levels of physical activity, nutrition, sleep, and avoiding alcohol and drug use to promote both physical and mental health and well-being and to prevent mental health problems. So really, really, this is the core right here. This is the most important, I think, overall conclusion and implications. Then there were a couple of documents I wanted to show with you. How much time we got? Okay, so we got a little time. So lifestyle behaviors and mental health protective and risk factors. So this was out of youth.gov, and risk and protective factors for mental and emotional behavioral disorders among adolescents are usually described and conceptualized within three domains: individual risk and protective factors, family risk and protective factors, and then broader school/neighborhood. If you skip down to number three, all 6 individual protective factors and some of the family and community factors are associated with lifestyle factors of physical activity, sleep, and healthy eating, as well as risk factors of substance use. So a good portion of, in fact, all of the individual protective factors are lifestyle related. And so addressing these could have a really impact on improving mental health. And this continues that discussion, interventions that simultaneously target multiple lifestyle behaviors, specifically physical activity, healthy breakfast and nutrition, sleep, avoiding substance use, are likely to address multiple protective and risk factors for improving mental health and well-being of young people. Take it a step further, under number 4, prevention plus wellness programs and our new media campaigns hold promise to for protecting and improving the mental and emotional and behavioral health of young people across the United States, because prevention plus wellness programs integrate the prevention of either alcohol or e-cigarettes and tobacco or cannabis or opioids or drugs in general, while promoting physical activity and sports, breakfast and nutrition, sleep, and stress control. So very, very important. That's under youth.gov if you want to learn more. And you're going to get these slides, so you can always look at these. There was a report published in the New Brunswick Health Council that, again, sort of highlights or supports the youth.gov site. And this document showed that 3 of 6 individual level protective factors were related to lifestyle behaviors, including nutrition, physical activity, and sleep. These individual level protective risk factors for mental health can be addressed in lifestyle behaviors of youth. Again, one more time: sleep, critical; breakfast and nutrition, critical; physical activity, and interventions aimed at increasing those protective lifestyle behaviors while preventing substance use at the same time could have a synergistic effect and really exponentially enhance the mental health of youth. Here's some mental health resources for you. to learn a little bit more, including on our own website, that first item, Healthy Youth Lifestyle Guidelines, because really that's what we're talking a lot about. And, what are the guidelines for youth and how do we help youth? Because they're not, as you could, to go back to the very beginning, only a third are eating breakfast, not even mentioning the quality of that breakfast. And about 20% are getting physical activity and getting sleep they need. So really, really desperate need to improve those behaviors, enhance those wellness behaviors, those healthy behaviors, the big three, while at the same time addressing the avoidance of risky habits, alcohol and drug use. And so you want to learn more, there's our collections of our programs, at least PPW programs, and you can request us a program sample, and you could contact us here, preventionpluswellness.com, info@preventionpluswellness.com is our email, and 904-472-5022 is our phone number. And boom, that's it. Thanks so much. I rattled through it. Now, let's see if you have any questions or comments. Let's pause at this time. While you're thinking, if you have anything you want to say, this is your time. Anything you want related to this issue and would be ideal. But anything going on in your professional lives, you're welcome to share. This is your time. We have all of 7 minutes. And it gives me an opportunity to thank you all for the tremendous work you do as prevention and health professionals and heroes throughout the country and world. Thank you so much for all you do. God bless you guys for your work, for your influencing of youth. There's so much that needs to be done, and youth are in so much need for so many things. So thank you. And if we can help in any way, let me know. Any questions or comments? Now's the time to ask. Remember, while you're thinking about that, I will be sending you these slides. I will be sending you the link to this recorded webinar. I'll be sending you a certificate for CEU. Next week, Wednesday, I think, we'll be having a brand new webinar, Introduction to Prevention Plus Wellness Programs, Media Campaigns, and Training. It's just going to be an overview of all that we offer. So it's, if you're interested in that, that'll be, I think, next week, Wednesday, same time. So, okay, I don't see any questions. You sure? Last chance to type in anything you might have with regard to questions or comments. You just go into your chat space or your Q&A and type it in. Just give me another minute or so. I don't want to cut anybody off if they're thinking about something. If you want any more information, if we can help in any way, let me know. But really, youth are in need, not just of substance use prevention, which is so important, but the promotion of these wellness behaviors, which are associated, the big three health behaviors, which are associated not just with physical, but also mental health. And so it all ties together. That's what we do at Prevention Plus Wellness. We integrate these. That's why our messages, and they're not just separate, they're literally integrated. So youth learn that engaging in sports and physical activity will give you these benefits and change how you view yourself in this positive way in the future: fit, active, successful, greater performance, etc. And by the way, alcohol or e-cigarettes or marijuana is harmful and interferes with you achieving those benefits. That's how we integrate those behaviors, those messages. Very, very important for youth to learn that and be reminded of that. I don't see any. Oh, there's one chat. Let me just see if there's one comment here. Let's see. Fantastic presentation. Thank you so much. I appreciate that. I don't see anything else, so I'm going to say goodbye. Thank you. Oh, wait, here we go. We got many thanks for all of this information. Extremely informative. No school should continue to eliminate recess, especially among children. I agree with that. Any opportunity to get up, get fresh air, move the body. And really, I mean, we've gone in the wrong direction, the opposite direction with regard to integrating opportunities for youth to eat well, and to sleep and to get that physical activity in sports that they so desperately need, and is so important to their substance use, their other risk behaviors, and here today to mental health. So thank you all. Have a great day, and hopefully I'll see you in the future. If you need me, preventionpluswellness.com. You can reach me there. Thanks, everyone. Have a great day. Bye-bye.